Welcome back, everybody, to the OPT Network. We're talking to a game changer who is really on the front line of helping women feel like women again after a mastectomy. Our guest this morning is Dr. Constance Chen. She is a board-certified plastic surgeon with special expertise in the use of innovative natural techniques to optimize medical and cosmetic outcomes. Dr. Chen, good morning and welcome.
Thank you. Good morning.
So before we talk about mastectomies and what happens after, let's talk about your journey into plastic surgery.
My reason for becoming a plastic surgeon was I wanted to restore women's bodies after they faced a struggle with cancer or the potential struggle with cancer. And it was to give them a sense of themselves so that they would feel whole again after something had been taken away from them.
Mm-hmm. I'm always interested in people's backstory. How did you get to become a surgeon?
I started out in publishing. I was one of the founding editors of Men's Journal, and then I wrote a biography of Mary Ware Dennett, a contemporary of Margaret Sanger's, called The Sex Side of Life, Mary Ware Dennett's Pioneering Battle for Birth Control and Sex Education. And during that time, I had a cousin who killed herself, and that really shook my world. I felt like I had a wonderful life. There's nothing wrong with throwing parties or anything like that. I used to throw a lot of parties. I had a very social life, and I felt like I wanted a more meaningful life. I felt like I wanted a life where I could more directly serve humankind. Although I have to say, in retrospect today, I do feel like people in publishing serve the world quite profoundly with a written world, or in your case, broadcasting the spoken word. But back then, I just wanted to be able to do something I wanted to be able to save my cousin and others like her.
And then so you had for all intents and purposes, you had a great career and life in publishing, and then you make the psychic change and you decide medical school.
I had not taken any pre-med classes in college. I took them all post-bac in a year while I was doing my book tour. Then I went to medical school. I did a lot of research looking at cross-cultural influences in psychiatry, looking at gender and race specifically. I did research with orphans in China, and I did all this without even thinking I was going to practice at the end. I was going to go back to publishing, but then I did a surgical rotation, and I loved it. I loved working with my hands. I loved being able to treat people who had problems and make them better. And I learned about breast reconstruction and the special type of breast reconstruction called Perforator Flap Breast Reconstruction, in which women who had mastectomies could have their breasts restored using their own tissue without sacrificing muscle. And at that time, that was revolutionary in the plastic surgical world, because really nobody else, there was one person that was doing it, and there was a lot of doubt about whether it was something that could be successfully done. It's actually much more common today. But at the time that I learned about it, there were very few people doing this specific technique.
And so what did you think about the challenge? And being that it wasn't as common as it is now, how you would proceed in doing something at the time that was more of a specialty? What goes into taking that challenge on?
Well, in order to do microsurgical breast reconstruction, you have to do an entire plastic surgery residency. So you have to do 5 years of general surgery, 3 years of plastic surgery. Often you need to do research. And when I was in medical school, once I came upon this type of breast reconstruction, I knew that's what I wanted to do. And I did a U-turn with regard to my life course and decided I wanted to dedicate myself to women's health and restoring women's bodies who had something taken away from them by cancer. Microsurgical breast reconstruction is one of the most complex types of surgery in plastic surgery. You need fellowship training. These are 12-hour operations sometimes. They're very, very big operations. I take skin and fat from one part of the body, usually the lower abdomen, sometimes the upper inner thighs, and reconstruct the breast by sewing together tiny arteries and veins, and I also sew together nerves to try to restore sensation.
Wow. When did you know, and so you're using a microscope?
Yes.
When did you know that you had a gift for this? Because this is truly a gift.
It is a gift. It's a gift that I think can be learned, but it needs to be learned with honestly, it needs to be learned with love. Because when I am reconstructing somebody's breast, I don't think of it as a case or as an operation. I think of it as this is a human being who is going to sometimes live the rest of her life with these breasts, sometimes longer than she lived with her breasts that she originally had. I have patients who are in their 20s and 30s, sometimes who have, for example, the BRCA gene, and they're having prophylactic mastectomies. They don't even have breast cancer.
Right.
They have sometimes an 85% risk of developing breast cancer at some point in their lives, and they have seen their mother, their aunts, their grandmother, sisters, oftentimes multiple women in their families die of breast cancer, and they don't want to die. And so they undergo what to many people sounds like a drastic solution, which is to prophylactically remove their breasts. So these women with no disease, when they wake up, they want to have breasts that look normal, especially, at any age. I think every person and every woman wants to look and feel normal. But when you don't have a boyfriend, you're not married, you haven't lived your entire life, even more, you just want to wake up feeling normal. And I think that at the end of the day, it really just comes down to caring.
So for those women, and I think it first came to many of our attention when Angelina Jolie was one of those women who carried that gene, and she had her breasts removed. And, before I really started looking more into and reading about the work that you've done, I never really thought that when you have a mastectomy, I thought, okay, you have reconstruction, you get probably the breast that you maybe always wanted, but I didn't realize that there was no feeling there, and that without the work that you are doing, they are just that. They are just breasts for aesthetics.
So in the United States, if you're going to undergo a mastectomy, you can decide to have a reconstruction or not. And if you do decide to have a reconstruction, 80% of women will undergo tissue expander and implant-based breast reconstruction, which is what Angelina Jolie had. In that case, your breasts are removed and an implant is placed into the chest where the breasts used to be. They can be silicone, they can be saline, they can be different textures. It can be over the muscle, it can be under the muscle, but the concept is the same. And the reason why this is the most common type of breast reconstruction is it's the easiest to do, and it gives you a breast form that looks okay under clothes. I think for many women today, that's not enough. They want to look normal without clothes. And when I started reconnecting the nerves, we took it a step further, and it wasn't just the way you look, but the way you feel, and how your breasts feel to you, like they are a part of your body. And because when your breasts are removed, all the cutaneous nerves are transected.
What are the cutaneous nerves? What does that mean?
Cutaneous nerves means nerves that innervate your skin. So the nerves that give you feeling.
Okay.
And so when those nerves are cut, then you will not have sensation in your breast, especially if you have breast implants, because the silicone and the plastic of the implants prevents the nerves from growing. When you have your own tissue, the nerves can grow into the tissue. And what I try to do is I try to reconnect the nerves to give it an extra special boost so that it has, it's basically replugging the sensory nerves so that you can feel again.
Mm-hmm. So it's almost like it almost seemed like it's like repotting a flower, like, you know, taking it out of the soil but putting it back into the soil, and then now it grows.
To a certain extent, it is a type of transplant.
Mm-hmm.
When you move tissue from one part of the body to another part of the body, it needs to stay alive. So when you do natural tissue breast reconstruction, you're creating living breasts. You're reconnecting the blood vessels, so the arteries bring nutrients to what we call the flap of tissue, and the veins take the waste products away from the tissue. So you now have a living shape that is soft and warm and gains and loses weight if you gain and lose weight, unlike an implant, which kind of sits there.
Mm-hmm.
When I reconnect the nerves, the arteries and veins don't come, that doesn't involve the nerves. When you reconnect the nerve, that allows the sensation to come back.
Wow. And so has this become so common that women now understand the option of nerve reconnection as opposed to just having an implant? Because what I'm always concerned about with friends that I know that have opted, and some just have done nothing, have just remained without breast. But I often am concerned about putting a foreign object, silicone or otherwise, in your body, what that does to the body over time.
Well, that is a concern. The FDA last year recommended that all implant manufacturers put a black box warning on implants because of the problems that they can cause women. You're probably aware of ALCL, anaplastic large cell lymphoma, which is a type of cancer of the immune system that can be caused by breast implants. And it's very, very rare, but there are women who have died from that. So when people have breast cancer and then they survive the breast cancer and then develop a different type of cancer from their implants, obviously that's a problem.
Mm-hmm.
So this is an unusual type of cancer, but there are other problems that breast implants can cause, such as breast implant illness, which is something that is not widely accepted by the medical community, but it's something that many women, hundreds of thousands of women, at least in this country, talk about, which is all sorts of symptoms that they have that they associate with their breast implants, such as autoimmune issues, joint pains, hair loss, funny smells, eating food allergies, gastrointestinal issues. And there have been a couple of studies, one that came out of MD Anderson in January of 2019, and one that came out of Israel in December of 2018, that showed a high correlation of autoimmune diseases such as scleroderma and lupus and Sjogren's syndrome, with especially silicone breast implants. So it's not that breast implants will automatically cause this in every person, but I don't think you are crazy to think that for some women they don't have a positive reaction to implants. And unfortunately, I think a lot of women, when they do complain of these symptoms, are written off by their doctors as being crazy.
Wow. So with the reconnection of the nerves and giving the breast feeling, talk about how gratifying it's been, not only for you, but for those women who didn't know that it would be possible?
Well, I think of a woman that I operated on about 8 or 9 years ago now. She had the BRCA gene and she was diagnosed with breast cancer. And she was sent to me from her breast surgeon for mastectomies, which she did not want to have because she came in with a New York Times article that was published that day saying that when you have mastectomies, you are numb after your mastectomy, and she didn't want that. And as a BRCA patient who had breast cancer, her risk of, if she had a lumpectomy and radiation, which was what she was considering, was high. And her breast surgeon really counseled her in her case with her type of breast cancer that was not necessarily that was just not going to be a smart option for her. And so she did she went for several opinions. She ended up having bilateral mastectomies with deep flap, which is a type of perforator flap breast reconstruction in which I reconnected her nerves. She also had nipple sparing mastectomies, which is a whole nother subject of different types of mastectomies you can have. So when she woke up and after she healed, not only did her breasts look normal, but over time she developed sensation, and she would come in her sundresses and just in her clothes and feeling normal. She later got married, and I remember about a year later, I said to her, remember when you came to me and you thought that you just didn't want mastectomies because you thought your life was going to be over and you would be numb? And that never happened. And she said, yes, I know. I didn't know that at the time. And when you say that it's important for women to know that they do have options, I think that's very true, because I think many times when women are faced with breast cancer and the possibility of having a mastectomy, they think that their choices are limited, and they're often told that their choices are limited. They're told that they can go flat, which is a completely viable choice, and I tell that to every woman, even though I'm a plastic surgeon who does breast reconstruction. I always start out by saying one choice is to go flat. There's nothing wrong with that at all. It's your body, and it should be your choice what you decide to do with your body. One choice is to undergo implant reconstruction, which the benefit of that is it's a simpler surgery. There's only one surgical site. You don't have scars or surgery in another part of your body. And every plastic surgeon knows how to do it, so it's widely available. Many women don't know that it is a possibility to use their own tissue to reconstruct their breast. And they should be told that this is something that's possible as well. It doesn't mean that every woman's going to want to do it, because as I mentioned, it is a big operation. You do have scars at the donor site, but if you want to have breasts that look and feel as normal and natural as possible to you as well as to other people, then that is something that you should know is possible.
Let's talk about the scarring, because I can hear people saying, okay, what does that look like? The scarring.
Well, so the scar for the deep inferior epigastric perforator flap, where you take it from the lower abdomen, is the same scar as a tummy tuck. It's a long scar. It's from hip to hip. It's not like a C-section scar, which is fairly short, but it's much longer. But it's the exact same scar as a tummy tuck. And the exact same tissue is taken out as in a tummy tuck as well, except for instead of throwing away the tissue, you use it to rebuild your breasts.
Wow.
I also will take tissue from someone's upper inner thighs. For example, very thin women. I often see women who are told that they're too thin to have natural tissue breast reconstruction. I've never actually met anyone who didn't have enough tissue for natural tissue breast reconstruction. And when I take the tissue from the upper inner thighs, particularly in thin women or someone who's already had a tummy tuck, then the scar is the same as in a thigh lift. So it's sort of hidden in the buttock crease. I can show you if you want, but I think it might be difficult on.
When you talk about taking tissue, there's always the concern maybe of scar tissue and how that will react in the body. What do we say about that?
Sure. So you will have scar tissue in the sense that you'll have a scar. It's a bigger concern when you have, for example, intra-abdominal surgery, which this is not. For example, if someone has a small bowel resection for colon cancer and you have scar tissue from that, that can cause problems with eating and all sorts of things over time. The tissue that we're taking to construct the breast is the skin and the fat, so it's fairly superficial. So that scar tissue doesn't tend to cause problems for people so much as something that is deeper in the body.
So let me ask about the question of lymphedema. Almost every friend that I know that has had her breast removed at some point deals with lymphedema. The way that you reconstruct the breast and the nerves, is that still an issue?
Well, interesting that you asked that. I am on the medical advisory committee of the National Lymphedema Network. And one thing that can be done about lymphedema is lymph node transfer, which can be done with natural tissue reconstruction or on its own, where you take some lymph nodes, usually from the groin area, sometimes from the intra-abdominal area, sometimes from other places, and you transfer them to the axilla for someone with lymphedema, and it can improve the lymphedema by allowing lymphangiogenosis to occur and a way for the lymphatic system to regrow.
Wow. And so I know a lot of people are going to be interested in this conversation and how they can live a better, more productive feeling life with their breast and even with lymphedema. Does insurance generally pay for these surgeries?
Insurance always pays for these surgeries. Even if someone has never had reconstruction or has had implant reconstruction, or it's mandated by federal law as well as many state laws that any insurance company that pays for a mastectomy, which is basically every insurance company, must pay for breast reconstruction as well as symmetry on the opposite breast if you've only had mastectomy on one side, as well as any complications resulting from surgery having to do with mastectomy or breast reconstruction.
And don't you think, Dr. Chen, it takes a special tactician? Because I've spoken to women who maybe just had like a mastectomy on one side and had reconstruction on the other, and were not pleased with the symmetry of the other breast.
Yes, so that I see people all the time with that issue. At the end of the day, I think that's where caring comes into place. I'm sorry to say it and make it sound, why should I apologize? I think at the end of the day, you just need to care. And that's what it takes to make something look good. You need to listen to the patient. As the surgeon, every surgeon needs to listen to the patient and her concerns and what she's saying and address those. Nobody wants to walk around with one breast up here and one breast down there. Right. Breasts, we all know that breasts are sisters, not twins. And I have seen many patients who have never had surgery who have asymmetric breasts. But at the end of the day, we want our breasts to be as even as possible. And we don't want to, it's part of not thinking about this every day and not waking up in the morning and getting dressed or going to the locker room or taking a shower and looking at yourself and crying or needing to put a curtain over the mirror because you just can't look at yourself. That's awful. As a woman, I want to look and feel normal, and I want my patients to look and feel normal. So women who are asymmetric can definitely get symmetry surgery, and that is also covered by insurance, by the way.
Wow. Before we've got to let you go, Dr. Chen, I want people to know where you're located on the web, how they can read articles that you've written, and just really take a look at the incredible work that you are doing to restore women who want to look and feel maybe not exactly like they did before mastectomy, but to feel a sense of normalcy in her breasts.
Yes, Before I say that, I just want to say, yes, I agree, maybe not exactly the way you were before mastectomy. Some people do look exactly the way they do before mastectomy, by the way, and can look that way. But my goal is always to have someone look either as good as or better than they did beforehand, if at all possible. But anyway, so with regard to, I'm located in New York City on the Upper East Side. At 875 Park Avenue, and my web address is www.constancechenmd.com.
Absolutely. Dr. Chen, we want to thank you for taking the time. You are one of those very special people in the world that is making a difference and actually cares about restoring women and giving them a sense of feeling their worth, because we know that maybe even, nobody wants to be in the sorority of women that has to have their breasts removed, let alone deal with breast cancer. But if you do, you certainly want to feel and be a semblance of yourself before surgery.
I think that every woman, like every human being, wants to feel comfortable in her skin, wants to feel like she can live the fullest life that she was born to live. And certainly her breast should not keep her from living that life.
Absolutely. Dr. Chen, thank you so much for taking the time. This has been an incredible conversation.
Thank you. Thank you so much for having me.
Indeed. Hey, everybody, stay on point. We're back after this.